Ryan Reynolds here from Mint Mobile. With the price of just about everything going up during inflation, we thought we'd bring our prices down. So to help us, we brought in a reverse auctioneer, which is apparently a thing.
Mint Mobile Unlimited Premium Wireless. How to get 30, 30, bit to get 30, bit to get 20, 20, 20, bit to get 20, 20, bit to get 15, 15, 15, 15, just $15 a month? Sold!
Give it a try at mintmobile.com/switch.
$45 up front for 3 months plus taxes and fees. Promo rate for new customers for limited time. Unlimited more than 40 gigabytes per month. Slows full terms at mintmobile.com.
Hello and welcome to Bytes of Health, where we hope to take a bite out of your parent worries each day with sound advice and guidance. Every morning, we'll answer a commonly asked pediatric question in 5 minutes or less. I'm Dr. Jess Steyer, a public health scientist, and today I'm joined by general pediatrician Dr. Dina DiMaggio. Okay, today we are going to talk about Lyme disease. The clock is ticking, so let's get to it. All right, Dina, summer is upon us. I'm sure you're getting tons of calls from parents who are pulling ticks off their kids. I live in the woods of Western Massachusetts, so literally every single day I'm pulling ticks off of myself, my kids, my dogs. So, all right, so let's talk about it. So first, what is Lyme disease and where does it occur?
So Lyme disease is an infection caused by the bite of a deer tick, or the technical term for this tick is Isodes scapularis in the East and Midwest, which is infected with a bacteria called Borrelia burgdorferi. So deer ticks can be found in places like grassy areas or marshy regions like near lakes or bodies of water. We personally just bought our house on Fire Island, which is loaded with cute deer, which carried some not so cute ticks. So I'm constantly scanning my kids for ticks every night there. Lyme disease occurs mostly in 2 areas in the U.S., with most of Lyme disease occurring in the Northeast, such as Connecticut, Delaware, Maine, Massachusetts, New Hampshire, New Jersey, New York, Pennsylvania, Rhode Island, and Vermont. It can also be found in the upper Midwest, such as Wisconsin and Minnesota, and on the West Coast, like Northern California. So anybody can get Lyme disease, no matter how old you are, and we mostly see it during the months of April and October, but more than 50% of cases also occur during June and July.
So I know I love to remind people, like, ticks can transmit a bunch of different bacteria. Lyme is just, or the bacteria that cause Lyme, that's just one type. And it doesn't mean that every single tick that you see will definitely transmit bacteria. I know that was something that I recently learned, and that helped give me some solace. So, but that being said, what is the best way to check for ticks?
So if you're in an area known for Lyme disease, every night you should do a thorough tick check on your child to make sure you do not see any ticks. We like doing it before bath time, so your child has to be naked and check her from head to toe. Ticks can often be found in easily missed places like behind the ears, which is really common, or on the head of the hairline, or in between the toes. So be sure to especially check those areas. In order to transmit Lyme disease, though, it's thought that the ticks have to be attached for more than 36 hours. So checking every night will ensure that you remove the tick before any transmission can occur and your child can become infected. This is important since we get a lot of calls that a child just came back, say, from a hike in the park, or a parent found a tick on them right after the walk and removed it and is now worried about Lyme disease. But I always reassure them that if they remove the tick really early, it's unlikely to be transmitted and no need to worry.
All right, so what is the best way to remove a tick?
So the best way the APU recommends to remove a tick is by using a fine-tip tweezer. So you should grasp the tick with the tweezer as close to the skin as possible, being careful not to squeeze the tick too hard, and pull it upward with a steady pressure off your child. Be sure to clean the area you just removed the tick with soap and water or rubbing alcohol. Often the area may look a little irritated from the tick bite, but this is not a sign of Lyme disease, but just really the skin being irritated from the tick removal.
So what are signs of Lyme disease?
So the incubation period from when a child gets a tick bite and when symptoms of Lyme disease can occur can vary greatly. The rash of Lyme disease can be seen anywhere from as little as 3 days to 32 days after the tick bite. Later signs of Lyme disease can happen months after the tick bite, in fact. In Lyme disease, we often think about the symptoms can be divided into 3 different stages, which is early localized, early disseminated, and later signs. So the most common signs in kids in early localized disease, what we see is the typical rash called the erythema migrans rash, which is seen at the site of where the tick bite was. This is what people classically think of with Lyme disease. Erythema migrans usually begins as a red mark that widens over days to weeks to form a large, usually greater than 5 cm in diameter, circular red area, and often has a central clearing. This is the target or bullseye rash that is commonly associated with Lyme disease. It is usually, but not 100% of the time, because nothing's 100% of the time, painless and it's not itchy. Other signs may accompany their erythema migrans rash, such as headache, fatigue, aches, and possibly a fever. Now, the next stage is early disseminated disease, where multiple erythema migrans rashes may also develop several weeks after the tick bite. Other signs that may occur with or without the rash are facial muscle problems, like one side of the face is droopy, meningitis, fevers, joint pain, muscle pain, headache, fatigue, or heart issues. Finally, there's late Lyme disease that can occur in children who are not treated at an earlier stage. The most common symptom in children of late Lyme disease is arthritis. It usually occurs in only one or a few joints, and especially seen in larger joints like the knees, which is typically what I see. The knee can look very swollen and red and tender. Infections of the eye and nervous system can also rarely occur. Children who receive proper treatment, though, with early signs of disease usually never have any late signs of the disease.
So let's talk treatment. How do you treat Lyme disease?
So it is very treatable, and it's treated with an antibiotic. The choice and the duration of the antibiotic depends on your child's symptoms and if your child has any allergies to medications. Usually we treat now with doxycycline or amoxicillin.
All right, what about prevention?
So if you live in or visiting an area with Lyme disease, again, do nightly tick checks on your child to remove an attached tick as soon as possible. Also dress your child in light colored clothing so it's easy to spot ticks, and long sleeve shirts, pants, a hat, and closed toe shoes when your child is playing in an area where ticks may be present. Use insect repellent such as DEET. Yes, it is okay to use, and it's approved even for use over 2 months old. But don't use a product with more than about 30% DEET or permethrin.
All right, so what if you find a tick on your child that has been there for a day or two? Is there anything that you can do to prevent Lyme disease?
Sure. So you can talk to your pediatrician about giving an antibiotic to prevent Lyme disease if all the following criteria are met. The attached tick is identified as an adult and nymphal scapularis tick, so a deer tick. It has been on for about 36 or more hours, and the prophylaxis is started within 72 hours of the tick being removed. So your pediatrician can give you your child a single dose of doxycycline if you find a deer tick on your child that has been more than 36 hours and has been removed for less than 72 hours. So call your pediatrician to discuss giving your child this one-time dose, which is not recommended at any age to reduce the risk of acquiring Lyme disease after the bite of an infected tick.
All right, well, I learned something. I hope you learned something, and we have lots more to share. You can get your Bite of Health every day, Monday through Friday. If you like what you've heard here, let us know. Leave us a review on Apple, and please be sure to tell your friends. Remember, there is no single or best way to parent. Parenting is a journey, and we are all just doing our very best. We wish you happy, healthy, and stress-free parenting.
If you like this podcast, can we recommend another one? It's called Big Picture Science. You can hear it wherever you get your podcasts, and its name tells part of the story. The big picture questions and the most interesting research in science.
Seth and I are the hosts. Seth is a scientist. I am Molly, and I'm a science journalist. And we talk to people smarter than us, and we have fun along the way. The show is called Big Picture Science, and as Seth said, you can hear it wherever you get your podcasts.